Sorry for coming in too early.
Apaga la cámara. Ah, sí. Para que si no, no se vea la sala vacía.
Hola Patricio, ¿nos escuchas?
Hola, sí, pero bajo.
Some more are coming right now, and I think someone said they had to do it, but have to do it online, but they'll be in the session.
Okay,
I sent them the link. Yeah, Alex, she's one of ours. Alexandra.
perfect.
Eugenia was here as well. Eugenia and Cameron.
Yes, sir? Yeah, I'm one of the people from USF Health. Hello.
Hello.
Sorry I couldn't come to the computer lab.
That's fine.
Hola Pato, ¿cómo vas?
Hola Miguel, ¿cómo estás?
Bien, bien, gracias a Dios.
Qué bueno.
Qué bueno verte, aunque sea a través de la computadora.
Sí,
Parece todo un presentador de noticias.
Bueno, creo que empezamos en un minuto.
ok.
Tenemos alumnos que van a entrar más tarde.
Sí, las casas se convirtieron en nuestros sitios para dar entrevistas.
Exacto.
Ahora sí, ¿me pueden ver? Yo con gafas puestas.
Sí, sí, todo bien. Se escucha bien también.
Perfecto, perfecto. Bueno, quiero empezar a darle todas las bienvenidas a estar aquí en este programa. Muchas gracias por su tiempo. Estamos aquí, yo soy Jessica Sanova, el director de programas internacionales aquí en USF Health. Entonces me encargo de toda la Facultad de Medicina, Enfermería, Salud Pública y Medicina. So I want to welcome everyone to the session. So this is a Global Health Conversation Series for students. So we're going to have an interaction between our students that are sitting here in this room and students that are in USFQ. For those who don't know me, my name is Jesse. I oversee all global programs across the colleges of nursing, medicine, pharmacy, and public health. So, thank you again. Entonces, cedo la palabra aquí al doctor Miguel Reina Ortiz. So, Dr. Reina Ortiz.
Sure. Thank you so much. Thank you, Lucy. Good afternoon, everybody. Welcome. It is my pleasure to be here with you as we celebrate National Public Health Week. Today, we're going to have a global health conversation series. Probably you've seen emails going around. This is an activity that's organized by Jesse's office. And in parallel to the Global Health Conversation series, we have the Student Global Health Conversation series. And this is the second one that we're doing, and we're doing with our partners in Ecuador, Universidad San Francisco de Quito, USFQ. We did an activity similar to this last year in fall. It was completely virtual because of the restrictions and the context of those times. But today we are fortunate enough to be gathered here in this room, and our partners in Ecuador, they are joining to us via Zoom. In Ecuador, we are partnered within the university with something that's called the Institute of Microbiology, which is an institute that prepares students in master's and PhD degrees in microbiology, with a focus a lot on molecular biology and basic sciences as applied to health. I am an alumna of the institute. I had the privilege to be educated in the institute with a great teacher. And Patricio was my classmate. We did together our master's degree, and now Patricio is the director of the institute. So he's contributed significantly to research in tropical medicine and in global health issues. His most recent publication, or one of his most recent publications that I know of, actually is in Nature. So he publishes constantly. His work is mostly focused on leishmaniasis and the use of aboriginal plants of Ecuador to try to discover new drugs for the disease. But obviously with COVID-19, I don't think there's a researcher in the health field that was not somehow diverted into COVID work, including Dr. Silva and myself. And that's actually why we're here, because we want to talk about COVID-19, but today we're going to talk about the impact of COVID-19 on other public health interventions. But before we jump into today's topic, I want to give an opportunity for Dr. Rojas Silva to introduce himself. Patricio?
Thanks, Miguel. It's a wonderful pleasure for me to be here and sharing with you. I just have to make a quick about my title. I'm not anymore the director of the institute. Gabriel Trueba, who was the professor of Miguel and myself, he is now is leading the institute. I'm still working, obviously, as a professor and researcher in the institute. I'm in charge right now of the master program as the director, and as Miguel mentioned, so these last 2 years, all the people that work in the institute put all the efforts related with COVID, even if we are not virologists, but we established one of the first molecular labs in a university to do the test, and we're still doing that. And we also established genomic surveillance. We were the first center doing that in Ecuador. Well, pretty much we are still the main center doing that in Ecuador, and yeah, it has been a tremendous experience with all the sadness related with the suffering and the death. But from the academic standpoint of view, it has been a wonderful opportunity to learn many things, and hopefully we will not have the same problems in the future, especially in countries like Ecuador, which is a very, it's a low middle income country, but in related with health, the situation is much worse than you can imagine here. So that's why we decided to discuss with you these related problems with COVID that are also very important. So what's going on with the other infectious diseases, especially HIV, malaria, and tuberculosis, which for many years has been the leading infectious diseases. But with COVID, the focus of the research, and especially in countries like Ecuador, most of the resources went to just this problem right now, and that's a tremendous impact in these other diseases. Luckily for us, malaria, it hasn't been a real problem for a long, for maybe the last 20 years. The incidence has decreased dramatically of malaria, but tuberculosis and HIV are like in other countries, in tropical regions, are very, very important. So again, thanks for organizing this talk between the two groups, and hopefully we will continue doing similar similar meetings, especially among our students. So thank you so much for having us in this meeting.
Thank you, Dr. Rojas. So the way we're going to work today is that we have decided on the topic, and we have selected, or we have invited a group of students to be panelists, students from USF Honor and students from USFU will also be panelists. So I think maybe what we could do before we start the conversation is we have a short introduction of the panelists, and then we can have the conversation. And we have also audience members here in the room. So maybe we can start with your team, Dr. Rojas Silva. They want to do a brief introduction. By the way, the video is being shown here, so if they can see, so if they can turn on the camera, at least during the introduction when you talk, that would be good. That would be good, so we can see their faces as well as we interact.
I'm sorry, my microphone was off. So we have two students as part of the panel. The first one is Maria Fernanda Zurita. Could you please turn on your camera? So Maria Fernanda is one of our students in the PhD program. She's actually in her 4th year. She is working with HIV actually, and that's why she's going to talk about something related with HIV and COVID, especially in our country. The other panelist is a student from our master program. He's currently in the master program is just 2 years program, so he's finishing his 1st year. Is Santiago Naranjo. Santiago, you can turn on your camera, and so he actually works with vectors. She's working with Sonia Zapata, which is a parasitologist and entomologist, and he's interested in working, trying to find some potentially emergency viruses from mosquitoes in the jungle, in the Amazon jungle. So the two of them are going to be our panelists from our side. We also have other students that are in this meeting, but Maria Fernanda and Santiago are going to lead the discussion from our side.
Great, thank you so much. Would you like to introduce your students so that we finish the run-up with the students in the program?
Sure. So Ronnie Pivake, it's a student in the master program as well. He's finishing his 1st year. Actually, he's my student. He's working in my lab. He's learning how to culture leishmania and macrophages and we are to begin to test some compounds that we have. Ronnie did his undergrad studies in Australia. He was awarded with a scholarship from our country as one of the best students in the country. So he had the opportunity to go to Australia. If I don't remember correctly, you can correct me, Ronnie, but it was Queensland University.
Yeah, yes, that one.
Yeah.
University of Quito.
University of Quito, exactly. We have Erica Munoz. Erica is working with us in the lab. He joined our group last year, and she was working with COVID, helping with the genomic surveillance. She will be one of our master students in August. The other student is Mateo Carvajal. Mateo was one of our undergrads in the institute. Now he graduated this year and has been working with us also in the genomic surveillance. Interestingly, we have Martin Zamora. Martin is actually a student from high school. He's doing an internship in my lab the last 2 or 3 weeks. I don't remember exactly, but he is very interested. He's very eager to learn many things related with what we do, and hopefully he will be one of our students next year when he finishes high school. And Rommel Guevara, he was also a student of the master program. He graduated this last February, and he's working with us right now also in the genomic surveillance. So this is the students that we have from our side.
Thank you so much, Dr. Silva. Dr. Rojas, his name is Patricio Rojas Silva. I just got confused. But Dr. Rojas, thank you so much for the introduction. I really appreciate that you have invited to the conversation a range of students from different levels, all the way from high school to doctorate. I think that's awesome. I'm looking forward to this conversation more than I was already doing so. So before we continue, on our end, I would like to allow Connor to give like an introduction, a few words, because this is a student global health conversation series, and it has been organized and supported mostly by the Global Health Student Association, and Connor is the president of the organization. So I allow him to.
Hello, everyone. Thank you for joining us today. My name is Connor McCarley. I'm a second-year Master's in Public Health student with concentrations in global health and epidemiology. We have students in a wide range as well. We have some undergrad, grad, and PhD with us for our panel. And we are very appreciative of the students down at USFQ who could participate with us in this and make this possible, especially on International Health Day. Now I think I'd like to pass it off to our panelists so they can introduce themselves. Should we start with the ones online?
Sure.
I think we have 2 from us online. Alexandra, do you want to go first?
Yeah, sure. Hello. My name is Alexandra Bonds. I am a senior majoring in public health and I'm about to complete my bachelor's degree in the fall. My specialty focuses on the anthropological aspects of COVID-19 and how human limitations of those factors have been impacted due to COVID, as well as chronic diseases.
Okay, thank you. Cool.
Hello, everybody. My name is Akul. I'm a biomedical sciences major. My focus is primarily projects that revolve around global health and preventative care.
And we can start going over the students here.
I'll go first. Hi, my name is Amira. I'm a second-year public health student. I'm also pre-med, so I'm really interested in how biology and medicine does branch into public health. And I don't really have a main focus just because I am a second year, but I am interested in global health and epidemiology, as Connor is concentrating in.
My name is Lauren Montalano, and I'm here today because I would like to learn more about infectious diseases. I'm a public health major as well, and tropical medicine, so this has been an interest of mine, and this is the conversation I like to find myself in.
Hello, I'm Cameron. I'm in my first year of my master's program with epidemiology, and for similar reasons, I have a big interest in infectious diseases and tropical diseases. I would like to learn more about prevention and what methods are used to stop the spread of these diseases.
Good evening. My name is Eugenia. I am majoring in public health with a concentration in epidemiology. This is my second year, and I'm interested in this conversation because I'm interested in global epidemiological aspects and how we can work to better the systems that combat infectious diseases and its spread. So, thank you.
And then we've got two more hiding in the back there.
Hi, my name is Miguel. I'm a second year MPH student concentrating in global communicable disease. My main interest is looking at climate change and its effects on vector-borne diseases and their environments that they grow and survive in. So, yeah, thank you for having me.
Thank you, everyone. Hello, my name is Carlos Recos. I'm a PhD first year in public health student. My focus specializes on international health disparities, and I have been focusing lately on cancer and oncology disparities. Thank you.
Thank you all students for participating, and I'll pass it back to Dr. Reina Ortiz and Rojas Silva.
Thank you so much. We have a couple of students over there as well. They are part of the audience. I don't know if you want to introduce yourself quickly.
I'm Macy Kuhn. My major is in biomedical sciences, and I have a minor in biomedical anthropology. And I see that those two overlap a lot with public health, so I wanted to come and kind of listen to this conversation.
Thank you for being here. Thank you for being here. Looking forward to the conversation. Sir?
My name is Monterius Mason. I'm a junior majoring in public health.
Perfect. So, as Connor mentioned, we also have a diverse group of people here. I'm going to turn this to the panelists here just because we hope this to be a conversation among students, mostly, and Dr. Rojas Silva and myself are glad to be here and try to help you with guidance as needed and moderation. But really what we want to talk today about is that we want to do an analysis and a reflection on the impact of COVID-19 in public health efforts across the world, right? And when you think about the pandemic and the impact of the pandemic, we already know that it has been definitely one in a lifetime, one in a generation event that has touched every aspect of human life, and I'm not exaggerating here, and in every region of the world, right there. A village as remote as it may be has been impacted by COVID in some manner, directly and or indirectly, right? But a lot has been said about the impact of COVID, directly from the disease, the respiratory complications, the neurological complications, the cardiovascular complications. Just today in the news, there was an article that a research study from Sweden has indicated or suggested that people who suffer COVID-19, especially severe or mild or moderate COVID-19 in the first wave, have an increased risk of clots, of dangerous clots, 6 months after having the disease, right? And that's just, like something else that has been added. And I remember when the pandemic was starting, a lot of people asked me questions about like, so what do you know about a COVID-19? What should we do? How long is it going to take? How long does the vaccine protect? All these questions. And my answer was always from the beginning, it's like, this is a new disease. Whatever we know is limited. Whatever I can tell you may change. So we need to be ready for new knowledge to appear, right? So it would be remiss, it would be a mistake at the beginning of the pandemic to pretend that we know everything about a disease that didn't exist 3 years ago, right? So we need to learn as we go, and we have learned quite a good deal. But as I said, a lot has been said on the direct impacts of COVID-19 and indirect impacts also like in terms of mental health, right? The increase on depressions, suicidal ideation, and suicide as well, right? The economic impact of the disease, the impact on education attainment and educational access, right? All those things have been said. But what we wanted to talk about today is what has been the impact of COVID in health other than COVID itself? What are we trying to say? Using just HIV as an example. HIV, it's another pandemic, right? Around 40 years ago, when HIV was first identified in the world, we didn't even call it HIV at the time, right? But it was a cluster of cases of Kaposi sarcoma and a pneumonia by a pneumocystis jirovecii and other diseases that you would not normally see in a person who has a competent immune system, right? So a cluster of cases, a new disease, pandemic, fear, stigma, and a lot of learning to do, right? 40 years into the pandemic, about if we go back 3 or 4 years ago, where were we in HIV world, right? We were moving towards and pressing towards achieving the 90-90-90 targets that you may be familiar with, right? 90% of people living with HIV should know that they are that their status of them 90% should be under treatment, and of them 90% should be on viral suppression. And viral suppression is important because U equals U, they say, right? So undetectable means equals untransmissible, right? When a person living with HIV has a viral load that is undetectable, the risk of transmitting the virus forward is negligent. It's almost zero, right? So we were pressing towards those changes. The number of new infections by HIV was reducing dramatically, not at the rate that we would wish, but it was reducing. The number of deaths due to AIDS was also reducing. And overall, we were optimistic about the progress we were making. But what happened when COVID came? That's what we want to discuss, right? What happened to our efforts on HIV prevention and control, right? And not only talking about HIV, I use as an example, just because I'm very interested in HIV work, but the same can be said and has been said and could be said about malaria. My colleagues in ASTMH, the American Society of Tropical Medicine and Hygiene, have been discussing for almost a year already this question: what is the impact of COVID-19 on our efforts to control malaria, right? Because definitely there has been an impact. So we want to talk about that today. Tuberculosis, Dr. Rojas Silva mentioned tuberculosis. I know tuberculosis is near and dear to his heart for a long time. Our efforts to control tuberculosis might also have been affected by the pandemic. And in tuberculosis, we have the other concern, that is the co-infection of tuberculosis and HIV and the development of XDR and MDR tuberculosis, right? And here we're only talking about infectious diseases. But what about the impact on chronic diseases? Probably you remember Hurricane Irma 2017, and around that time, Hurricane Maria as well. Everybody talk about the impact of Maria, how a lot of people in Puerto Rico were impacted, and how people were displaced. A lot of people moved from Puerto Rico into the mainland in the United States. But really, not a lot of people talk about the impact of Maria on the management of chronic diseases. People who had diabetes, people who had hypertension, people who had cancer and needed the surgeries, people who had scheduled surgeries. What happened to all those people? How many people died in Puerto Rico because there was an interruption in services that were essential for maintaining the health, right? So in the same manner, we can talk about COVID-19. How many of our normally scheduled services in health were being impacted and interrupted because of the pandemic? Not only because we have diverted efforts, and again, I don't want to take space for what you are going to discuss, but not only because of efforts and resources being diverted, but because of personnel falling victim to the condition, to the disease, and being out of work for weeks, or sadly even unfortunately passing away from COVID-19, right? So again, this is just as a brief introduction of the conversation that we want you to have and provide your insight and from your experience as a student. How do you live through this pandemic, and how do you see from a student perspective these challenges in the public health systems in the United States and in Latin America and across the world, right? So that's like an overall introduction of what we want to do today. I don't know if Dr. Rojas, if you want to add something to that.
Not really. I think you made very clear what we want to discuss. So I think it's time to pass the opportunity to our students to start to discuss these serious problems that we're going to face from now on.
Excellent. So why don't we start discussing what has been the impact of COVID-19 on infectious diseases? Should we start with that? So what has been the impact of COVID-19 on the prevention and control strategies of infectious diseases with a focus on developing nations, Ecuador, Latin America, perhaps Sub-Saharan Africa as well? I leave the floor open to that discussion.
Sure.
I can talk a little bit about it. So hello with everyone. I am working with people living with HIV in Ecuador, and during this period, during the pandemic period, we have seen a lot of problems. For instance, there was a disruption in the testing and treatment services here for a long period, and for the people it's difficult to get medicine by themselves. They are really expensive, and they only can get their medicines by the public services, and the services were disrupted, and the people can get their medicine. So this caused that the treatments were stopped, and also the prevention the programs were stopped too. So there are models doing by WHO and UNICEF that they are viewing in the future on an increase of the number of people with HIV, because we know that if the people are treated, the levels of HIV, the viral levels are reduced, and also it's blocked the transmission. But during this period, if the people couldn't get their medicines, the transmission should be higher. So we expect that the next months there will be more people than expected in the normal years, with more transmission with HIV. Also, the difficulties in the treatment, in the services, in health services for women who have children, women with HIV, but during the birth, the delivery birth, may be they didn't receive the treatment that they should. So there are many problems, but I also think that there were opportunities during this period. I could see that in the hospital that I am doing my research, the authorities put more attention in the equipment that the laboratories need. For instance, for us was a dream to get an gene expert PCR diagnostic in the laboratory of this hospital, but now they have. So I think this also show in a big picture to the authorities the importance of the equipment and also the let's see, the investment that they should do to reinforce the healthcare system and also the research system that we need to have. Reinforce the research system, the small research system that we have, but also increase the researchers, the team of researchers that we need to be aware in any time about these infectious diseases. So for me, we have two sides. The bad side that is the biggest, but also I hope this will represent an opportunity to get better in the research programs and healthcare system that we have in Ecuador. This also similar than in other countries, the social problems with the people living with HIV, more of them lose their jobs, because we know that most of them work in the social networks, in the social activities, and during the lockdown they couldn't work, so they lost their jobs, or also there were increase in the difficulties to get an income and financial sustainability with people living with HIV. So I think this was a big problem. People couldn't have the treatments. Also, this can mean an increase in the acquisition of other infections, other opportunistic infections in these people, because we know that if the people is diagnosed by first time with HIV, if they are treated as soon as possible, they will have a better life, quality of life, a better quality of life. So many people didn't have their treatment and they stopped the treatment. So this means also deterioration in the health, in the quality of living of the people here in Ecuador. So yes, we have many things to resolve now, and it was difficult before the pandemic. Now it's getting a little bit harder, but I think also this gives us the consciousness that we need to give more effort to get there. This is what I have seen.
Thank you, Maria Fernanda. Just to clarify some things, so Maria Fernanda is working in a public hospital, doing her research with people living with HIV. And even though it's a big public hospital in Quito, in the capital city, they didn't have, as she mentioned, the technique and the required equipment to do the diagnosis, to test for how many viruses are in the blood of these people. and also to monitor how the treatment is going on. Or, you know, that like after 1 year or 2 years of treatment, you need to know if the treatment it's been successful. So all these tests have to be, you know, they take the blood samples and send away to do this. But now, as she mentioned, they already have one machine and people working in molecular techniques. So hopefully that will improve our the chances that the people don't have to wait a long time, and they will have this in situ in the hospital. So yeah, that's pretty much the situation. And we're talking about the capital city of Ecuador. So this is somehow this is how is the picture in Ecuador. So imagine in other regions of my country, the situation is terrible. Alexandra.
Sorry about that. I in the United States, I will admit this from a chronic standpoint, our physicians are burnt out. As in, we have so many patients going to the ICU, the doctors and nurses are so spread thin. So when you have a chronic condition like cardiovascular disease, chronic respiratory disease, which is what I commonly see when I read that report from the Pan American Health, they're like the people who have comorbidities, are more susceptible to COVID due to their poorer immune system, and B, the doctors just toss their hands. As in, if the person has it, oh well, because they already allocated their funds to COVID so far. So now you have to, they're more concerned about the infectious disease. So if you have the chronic condition, which is have a longer duration, you're basically on your own in that regard, because the doctors are not going to have time to focus on that, especially the primary care physicians, the ones that's in the ICU, and the emergency physicians.
Yeah, well, that was pretty much something that we have previously, and I just want to add that now that the cases are low in Ecuador, this is crazy. They have to they begin to fire people, medical doctors, nurses, all the people that were working during the pandemic. Now they're being fired in public hospitals. So this is just terrible right now. So Santiago.
Yeah, continuing with the topic, it's important to say in Ecuador, given it is a third world country, I gotta point out that there's COVID-19 impact in Ecuador as a third world country. Many resources were moved towards COVID and ICU development because ICU in this country that there wasn't that much, so the people were dying in the streets as seen in Guayaquil, and also it made growth cases and of different diseases as the ones I study, as let's say dengue and others, that not that much of a growth, but it was a lack of attention and medicine in hospital. Given it was taking too much attention towards COVID, that caused more people dying, and a lot of people dying without knowing what happened. And also, for example, that I study Oropouche virus, that is an orthoponia virus, and the lack of diagnostics, it's a lot. It got confused with dengue, with Zika, with chikungunya, that are flavivirus, and they all got confused with the same infection. They don't got the pandemic caused also a lack of resources for molecular or non-molecular diagnosis towards this infectious disease. Also, there was a reagent shortage in the whole country, and that's not saying the whole world, but this also caused that a lack of the detection, people dying. So the pandemic, as I know, causes to Ecuador chain supply problems, resources, a lack of resources, reagent shortage, problem in diagnosis, not just on the COVID, but also growing cases of another problems like Fernanda said in HIV that already suffer segregation and discrimination because of the well, people ignorance, I gotta say. So it's a big problem towards the economy and social problem. And given the resources of Ecuador as a country is not that big. As Patricio said, people is also getting kicked out of their jobs because their need is not there anymore. And also Ecuador still suffers from a lot of economic problems because before by politics and the pandemic was the main problem, I would say.
Thank you, Santiago. Any questions, any comments from here?
I just wanted to add, Dr. Rojas said that Ecuador is a low-income country, and I understand, like, from low-income countries that people utilize subsidized farming and working outside, and with the lack of access to healthcare due to the pandemic, you know, like a lot of doctors are getting fired, a lot of people can't find jobs. These people with chronic diseases that are working outside and they're tiring themselves out just to like save some money, like for food and resources and, you know, getting like as much access to healthcare as they can. They're like the doctor said, they're burning themselves out, like working outside. And I also wanted to bring up the idea of telemedicine or like telehealth. Telehealth is being used in the US. You know, like for people who can't go in person due to COVID. But with people in low-income countries, they can't utilize telemedicine or telehealth because some people don't have access to the internet or like digital devices.
Right. Thank you. So was that a comment or a question as well?
Oh no, it was just a comment.
Oh, it was just a comment.
Yeah.
Okay. Thank you so much. But yes, go ahead.
I would like to also add to that. First of all, I think this conversation is very timely because what we're seeing is that on a global scale, the world is recovering from a pandemic. So now we're focusing back on, okay, what has been going on this entire time, which are the chronic diseases. And so I think it's okay that at first we focus on just surviving the pandemic, and now we have to refocus on how can we save the patients that have the chronic diseases at the same time, focus on probably the sparse cases that are still COVID cases, because as you said, that the cases have lowered in Ecuador. It has also lowered here in the US. So now we're refocusing and then coming back from that, you know, as you said, it was a good experience because we get to see, okay, how can we make it through a pandemic, but at the same time, what are some things that we're lacking? So you said that there are some research equipment that we're lacking. So it's a good learning experience. We get to build a better force. So if we ever have another pandemic, then we can see, okay, these are the things that we need to put in place. These are the quote unquote essential things that we need to withstand a pandemic or any type of infectious disease upheaval, okay? So I think it was really good that first the United States and even on a global scale, everyone focused on this. We began to redefine what is essential, what is not essential. And unfortunately, some of the things that we define as not essential, you know, to some persons in all aspects, they probably were essential, like the chronic diseases, you know? We stopped certain patients from coming to the clinic. You can only come to the clinic for your medication refill. I used to work at a clinic and we stopped certain types of visits we were no longer taking. We were only booking COVID patients. And then if you needed to get your medication refill, then we know, okay, that's important. That was labeled as essential. So I think on a global scale, it is good that we're beginning to redefine what's essential and what is not. But I think in a fight or fight mode, as we are all going through on a global scale in the pandemic, we focus on this infectious disease. But now we're beginning to refocus on the chronic diseases. But at the same time, we have to keep a level playing field to see what resources we need to have in place. Even when COVID, does, kind of level out, we still need to say, okay, we need to have these type of resources in place, these type of networking with global health systems, these type of equipment in place, because as we've experienced this, now we know what we need. And so I think this conversation is very timely. because of that aspect. And I think it's okay that the world reacted the way we did. We did not have certain resources in place because we have not experienced that before. You know, like you said, sir, we have not been this way before, so we would not have known all of the answers. People were coming to you and they were asking questions about the vaccine, they were asking questions about the disease and, you know, the contraction, all these different things. And so I think it's very fair that we kind of diverted our gaze from the chronic disease, but I think in all aspects, like Dr. Rojas said, you know, it was a good learning experience, but at the same time, there are many deaths and there are many things. So we are coming out of a flight or fight response, and so now we're beginning to level back down, you know, and we're beginning to refocus and see where, okay, the resources that we do have now, what can we do, where can we position them to aid some of these things that have already been here and are still continuing to persist? What can we do now? And the things that have affected these chronic diseases like COVID and all the comorbidities, what can we do now to kind of get back from that, to make sure those patients who were affected from that, we can kind of repair their quality of life, okay, or to preserve their quality of life in some shape or aspect. So I think this is a very timely conversation, especially since the COVID levels are lowering somewhat all around the world, and now we can kind of reposition our gaze.
Right, thank you so much. What's your name?
Eugenia.
Eugenia. So you make a very good point that I would like to highlight here, and that's the point of reflection, right? We are at a stage where we can do good reflection and draw conclusions and lessons learned. I agree with you that there's not much benefit in judging whether our past actions were, you know, good or bad, so to speak, right? We have to react the way that we had to react, given the circumstances we were faced, right? But we should ask ourselves the question: could we have done it better, and how, for our next step, right? So that's part of the reflection. No, not in an accusatory manner, but in sort of like a learning process, right? So definitely it's a good time for reflection, and I appreciate that you highlight that. That it's as you put it very well. We're not in this fight or flight mode anymore. If you know, collectively, if we were only one organism, I agree with you. We reacted in a fight or flight mode as a human race globally. So, but now that the pandemics, the infection rates of COVID-19 are going down across the world, it's a good time to reflect. It's not a good time to let the guards off, right? Because we need to be prepared for what might come next with COVID or elsewhere, right? Sir, you had a comment or question?
Yeah, I had a question. Just thinking in regards to resource allocation and specifically the hospital that you're working at, Maria, in Quito. So they refined this PCR machine, and then I think Dr. Rojas mentioned that they then started hiring healthcare workers and doctors. And I'm just wondering, you know, given the nature of the pandemic and the similarities to infectious diseases like HIV, was there an understanding that both of these diseases required attention despite the pandemic going on? Was there a discussion when it came to like the advisory committee of the hospital about how to allocate this stuff, and what kind of decisions were made, or were you privy to how resources were allocated, I guess, during this situation? Because it's such a dire situation where you have to take care of people. You need prevention. The preventative side of medicine is so efficacious that you would think with the PCR machine that it would lead to further allocation into prevention of these diseases. But it also seems like there was some backtracking that went on in terms of losing personnel. And I guess I'm just curious about the dynamics there and what happened.
Yes, I think here in Ecuador, the authorities, because of we are a low-income country, the authorities give more importance to the things that are urgent, the things that are, but they didn't realize that the research programs, if we have scientists here in Ecuador, we can affront, I don't know, confront or affront, we can, let's see, yes, affront these problems. We can have better solutions. So
I think you meant health inequity at this point, because there is a health inequity regarding to the disproportionate amount of people who end up getting COVID and them not having access to resource. Sorry for interrupting you, but I assume that's what you were trying to say.
yes, we can face, yes, but I think sometimes we have we cannot see the big picture of the things. The authorities only can see the emergency, but can see the solutions. Because if we have a good shield, a good protection in our instead of get a defense to face the infection diseases, we can cope with these emergencies. So I think this is a good example. This pandemic was a good example and a good image for the authorities to see that it's better to be prepared, be aware, instead of just answer the emergency. So we need to choose our priorities as country. We need to see what are our priorities. If we can prioritize science, if we can prioritize research, we will be able to cope with these problems. So we have to work in forming these groups, with these scientific groups, researcher groups, in the topics that are from each country. Because in tropical, in our country, we have tropical diseases, but there are few people working on that. But when the problems get bigger or worse, then we have to run. And this is a thing that we have to repair. We have to change that. So I understand that during the pandemic, the authorities could see the importance of to treat respiratory diseases, but before they didn't know about it. They didn't put much attention about it. So I think we have to work in a low level in every time, but in each topic here in Ecuador. Here we have few people in each area of the healthcare system. So I need to improve that. We need more people working on that, and working to be aware, to be prepared, instead of just instead of just answer an emergency without any basement, without any previous research in our populations. In our population, we have a few gaps, excuse me, a lot of gaps in the information about the genetics of our population, about the infections, like like pneumocystis, girovesi infection, for example, in people with HIV, here is difficult the diagnosis. Sometimes just the physician only gives the diagnosis by the symptoms, but we don't have the technical equipment for this diagnosis. So this is there are many things. I know that we need money, that is because of the money, but also I think that we have to start to prioritize these things in the level that we can start, but we cannot leave it without the importance that we have to put on that. Ronnie?
Thank you, Ronnie.
Yeah. Okay. So I just would like to sum up like my experience with the COVID that I have been living. So to start with, is we are a low kind of middle income country, but the thing that affects us the most is the allocation of resources and the efficacy that we do that. For example, well, let's just say corruption. So at the beginning of the pandemic, there was a lot of things going on, like overprices for tests. For example, that PCR, like the lowest price that what was that, like the city council from Quito found it was like 3 times the price that was in the market, and that affected a lot. Like at one point for the diagnosis, like we could get triple of the diagnosis that we did at that time. And also answering the question, like the allocation of resources in terms of medical personnel, and that kind of also, I don't know, here in the public health system works like the allocations is for the resources are allocated for one hospital, and the hospital see like how it manages, and sometimes that also is not allocated properly, which is like really sad. So as I say, like we are a low income country, but we still have the kind of the resources to like put up a better public health system. But the problem of corruption is quite a big deal here. So that for one side. Disregarding, well, talking about the other type of diseases that we have, like dengue, Zika, or HIV, or these other infectious diseases. There's actually, for some diseases have been there has been an underdiagnosis. For others, there has been an overdiagnosis. So for example, I read an article like, I think 2 months ago, that there was an increase in the cases for dengue, but there was a decrease on the cases for Zika or something like that. But like the dynamics for like detection actually differ quite a lot among infectious diseases, and that's also like I think, I don't know, I say like another variable that we should take into account in order to how do we say, like I don't know who was the person that says the thing about prioritize the resources. It's kind of hard when like you don't know which is more important and which is less important, given that we have like a kind of inefficient healthcare system. I don't know how it works in US, but like I guess like you cover 100% of the diseases. Well, I'm just talking hypothetically, right? But we cover 50%. Like how from the 50% of the diseases that we are actually diagnosing and covering under all healthcare system should we prioritize if we don't know the full picture of like what is affecting us, how diseases are affecting our country and things like that. Well, I just wanted to to mention that.
Thank you.
Yeah, thank you, Ronnie. So yeah, in our country, the corruption before the pandemic was terrible. During the pandemic was super terrible. Now it's terrible as usual. So that's a serious problem. So we are not in a position economically as bad as other countries in the world. So as Ronnie mentioned, we can do better about that. So if we could manage in a proper way our resources, the impact of the infectious diseases and chronic diseases, because that is also very important in our country. So we, as in other Latin American countries, we have a lot of chronic diseases as well. So, but we can do better, and that's a very important point that Ronnie that I want to highlight that Ronnie mentioned. So the corruption in our health system in general, it's really bad. It's a situation that it has been really bad for a long time, and during the pandemic, actually it was worse than ever.
Thank you.
I think
Rojas. And before I let Alexandra and Michaela make the comments on this issue, I just want to make brief comments and we can move a little bit discussion now to the US side, right? So we talk about Ecuador and the challenges of the pandemic in Ecuador. So maybe we can talk about the US component of the discussion. So Alexandra, if you can please briefly state your comment or question, and then Michaela, and then we can move forward.
The US component of COVID-19 and our chronic conditions is that the way our healthcare system is structured is more privatized, as in it focuses more on the financial aspect of it instead of addressing more preventative care, which in my personal opinion creates more problems. The reason why COVID-19 is as bad as it is in the United States is some people don't want to go to the hospital, for example, because of the high costs associated with it. Some people don't want to do the preventative measures to prevent COVID-19 because of how COVID-19 is portrayed in the media. Like, for example, the criminalization of mask, as a mask destroys your self-expression. Basically, politicizing it is another issue. And the fact that we have socioeconomic problems in the US as well. So adding a disease like COVID-19 on top of that, and say if you have cancer or a cardiovascular disease, how you're supposed to manage that disease on top of everything else. You have to prioritize which one is more important. So maybe the best way to approach it is to offer more preventative care, so we won't have mass hysteria like in the situation we are in now.
Thank you, Alexandra. Michaela, you had your hands up.
Oh, yes. Kind of touching on what Santiago and Ronnie talked about a little bit regarding how dengue and COVID were showing similar signs and symptoms. So it's kind of hard to differ on whether or not like a patient had dengue or if they had COVID-19. And so you were missing cases that were dengue and then you were missing cases that were COVID. I think it just comes to show that with more emerging infectious diseases that is to come, it would be good to reassess diagnostic criteria for some of our infectious diseases that we have now, like dengue, since there are similar signs and symptoms between dengue and COVID-19. So I think that's something to take away. Granted, potentially in certain countries, it might be easier than others, but I think developing a global system where there's more of a connection rather than if you have one country here and one country here, like more communication on a global scale, I think is what is needed in the academic field as well. And then you can connect that with the US, where for here in Florida, we have a tropical environment and we have certain vectors that carry like Zika or yellow fever or dengue. And so we have surveillance here looking to see if that is being, or if we have any cases within the mosquitoes here. And with climate change, that's one big thing that I'm looking at, where how is climate change affecting vector-borne diseases and how potentially those infectious diseases like yellow fever, dengue, so on and so forth can encroach on the northern areas here in the US rather than just being here in Florida. But all around, yeah, more communication and reassessing our diagnostic criteria for certain diseases.
Thank you so much. Excellent. Yes, what's your name?
My name's Lauren. Lauren.
Lauren.
Yes, I would just like to add to what Alexandra said about doing the more preventive care, adding more preventive care. But a lot of that stems from having more education. If we had more education for people and we were telling them that this is what you're supposed to do, instead of, I think a lot of it's like fighting misinformation as well, because that's one of the biggest things that contributed to the spread of COVID-19 in particular, because a lot of people are misinformed. No one knows what to do when it comes to like infectious diseases and how to manage it. And same for like chronic diseases as well, because the chronic diseases, we actually, I think I read something about chronic diseases, the number of healthcare services that were rendered to non-communicable diseases were actually, they decreased with the peak of the COVID-19 pandemic. So just knowing how to like manage chronic healthcare or chronic diseases like that, and with the infectious disease as well on top of it. Education is a pretty big route that we have to actually prioritize. Education is number one.
I think it was health education, correct?
Health education.
Okay. What's your name?
Amira.
Amira.
Yeah, I just wanted to add on to your point of education. I feel like the misinformation or like lack of education is within the impoverished communities in the US, or like low-income communities. And these low-income communities are the same people that don't have as much access to healthcare because of health insurance. There isn't any universal healthcare in the US, meaning like you have to pay for insurance, and then that's like how like you get reduced costs at the hospital. But most people don't have the don't have the money to pay for insurance, so they kind of avoid going to the doctor, so they don't pay. So I feel like universal healthcare would be a great solution, even though like it's been talked about and it's been mentioned, but I don't know, the US just like doesn't want to adopt it.
Right. And that's a good point. And just to give perspective, in Ecuador, the system is less privatized, as Alexandra and you are probably pointing to. The Ministry of Public Health in Ecuador, there's a Ministry of Public Health. Ministry is what we would call secretary in the United States, right? The department, like the Department of Health and Human Services, that corresponds to the Ministry of Public Health in Ecuador. And public health, though we know what public health is, and everyone knows what public health is, but the Ministry of Public Health essentially works as a provider of care for people with low income population in the country. So the Ministry of Public Health has hospitals, has primary care units, and has even a small village units. So essentially, it's a provider of care, sort of, not necessarily, but sort of like a universal healthcare system, right? It's not insurance. You don't have to pay a premium or you can reimburse anything. That's just provided for free.
There are, oh, sorry.
So no, go ahead.
No, I just wanted to add that there are free clinics, but the free clinics, like in comparison to the quality of hospitals, like it doesn't match up, because the free clinics don't have like all the resources that hospitals do, especially if people with chronic diseases don't, like they need like a higher level of care and quality.
And it would be the same level. The free services are limited in the ability to deal with health issues. Yeah. I'd say the penetration and coverage of the three system would be higher than it is in the US overall.
So the ministry oversees the health over all of Ecuador. Interesting. So there is like a standard for the country, a standardized way of sort of doing things.
As standardized as it can be, yeah.
Yeah. It's just one thing that's so different in the US. County by county, health mandates vary. And so when you have a pandemic like this, you can't have a standardized response.
Right.
And that's where you get into these counties where there's anti-mask sentiment or anti-vaccine sentiment. And yeah, you could stratify that across socioeconomic status, and I'm sure it would align with a lot of the other folks here would say. And it's just a shame because the preventative measures were fairly simple, social distancing, wearing a mask, being aware of other people in an empathetic sense. If that was just a standardized protocol, like even across a state, let alone, all 50 states, I think the outcomes would have been way different and it would have been relatively simple to enact something like that. But then when it came down to it, the mechanistic action of our healthcare system broke it down into all these different pieces where jurisdictions very over small borders.
Right, and you're right on that, but I think when you look at the question about it's a one system, but because it's a one system, the reaction time might be different, the decision-making processes are different, and the burden of the pandemic was really high in Ecuador. I don't know if you read the news. It was terrible. It was horrible. You would see people dying on the streets, and people needed to take their families, corpses of the family out of their home because there was not just enough funeral services to come and pick them up. So it was devastating. It was devastating, and the collective impact the psychological impact of this event was dramatic as well. Miguel, you wanted to say something?
I know someone else already mentioned this earlier, but regarding misinformation through different social media sites and then different countries, I think that also took a major toll on people's responses and preventing or taking the preventative measures. So I know some USF, there was this guy, I wish I know his name, but I believe he's doing a research project looking at different social media sites. Correct me if I'm wrong, but he's looking at different social media sites and where they were trying to debunk misinformation that was spreading within the Latin community. I don't remember in which countries he was doing that, but it just comes to show that misinformation was just being spread everywhere, and I don't know if this was necessarily misinformation coming from the US and not from other countries or what, but I think there's this information across the board that a lot of people took, and then that leads into then trying to increase the education within the general public on public health measures. And then with that, then that would be increasing education on more preventative measures. So it's also interconnected.
It is. Yes, go ahead.
I would like to add to that. I believe Alexandra started the conversation on this. We're more so scientifically guided in our mind as to solutions, but like you also said, Cameron, there are some cultural aspects that need to be addressed here too. Because if you're saying the CDC is saying there's a mask mandate, and that's one of the best ways we can avoid the transmission of this disease, and then you have a group of people who are culturally minded or have been culturally influenced to believe that that is a restriction of their expression or a restriction of their freedom, then you have a huge restriction there as to how far that mandate from the CDC can actually influence our society and actually impact us and affect the way that this disease spread across people. So I think that's something, even as we use as scientists and epidemiologists and personnel professionals in public health, even as we use those different mechanisms that are at our power to use, we also have to think about the social determinants of health. Because if you have a group of people that are not compliant with what is being best portrayed as the way that we can possibly decrease the spread of this disease, then no matter how many diagnostic equipment or research that we have in place, then we're still missing a piece of the solution that's very important to this effect. But the cultural aspect is a huge aspect of the actual, of it being effective in our society. Not just the scientific aspect, but the cultural aspect of making sure that there is that educational aspect instead. Because without that missing piece, we won't get very far in society, especially in low-income countries and low-income communities where there's a lack of education on the importance of these systems that we have in place and the decisions that are made and the mandates that are put in place and how it can actually be beneficial and not so much restricted, but let's look at the greater for all and not just the restriction of, the things that we may individually or in groups think,
And I said there's not only lack of understanding, but there's also mistrust from government, and not only in the United States, but in Ecuador and in other places. Miguel, you wanted to say something, if you can briefly add it, Dr. Rojas wants to say something, and then I would like to see if there are questions from our colleagues from Ecuador that they want to ask from you. Okay.
Kind of bouncing back on the whole point of like the need for communication. So I am an intern at Cook County Department of Health, and I work with the long-term care management team. And we go out to facilities to do infection control assessments. And recently, what I've been hearing from a lot of these facilities is that there is a lot of miscommunication to them from regulatory agencies. So anything from like CDC to NIOSH to OSHA to CMS regulatory agency, that all of them have their own idea of what they want long-term care facilities to do regarding infection control of COVID-19. And so I think, at least here in the US, there needs to be more communication within these agencies where we create a better standard of what is expected of long-term care facilities or other workplaces or just the general public. Because then we have burnout coming from all ends of administrators, ADONs, DONs, and trying to appease everyone with the regulations that are being imposed or recommended on them. So if there was more of a generalized response, as Cameron was kind of mentioning, that each county is also different too, then that also creates miscommunication. I hope you understand what I'm trying to say.
Right. I think we are pointing out to conflicting and overlapping regulations. Yeah, Dr. Rojas?
Yeah, so I just want to clarify one thing that maybe you are not aware. So how in Ecuador works the public health system. So we have these public hospitals where anybody can go. A problem is that most of the times they don't have all the resources, all the personnel, the healthcare workers, etc. We also have the social security system, in which if you are in a payroll in a private or public company, so you have to pay a premium. But it's part of your social security as you have in the United States, but it's also a health kind of health insurance. Okay, so you can have social security hospitals that provide services for people, which is kind of good. I mean, they're in a much better position. And in a third group of hospitals, we have the private hospitals, in which you have to pay. You can also have your own private health insurance, which people also, if you have the income, the resources, you pay. So you pay for your social security, but also you have your health insurance, your private health insurance. So one thing, so I want to change that we don't want to have a negative, that everything was negative in Ecuador during this pandemic, because after we changed the government, so that was on May 2021, so last year we changed the government. So the new Minister of Health, which is it's a woman.
Here's a problem, actually.
Yeah, so she developed a very good plan about vaccination. So that changed everything, because before that, the vaccination, we didn't have any vaccination plan. It was terrible. It was just terrible. So we changed government, and those things start to change. The health minister, Doctora, I forgot the name of
Garzón.
Doctora Garzón. Yeah, she's a Dr. Garzón. Also, she did a PhD in public health, something like that. She worked in the university also. She was a professor in one of the universities. So she started to improve also these things that public health system and the social security system start to buy equipment, having more personnel working in these areas of diagnosis and especially molecular diagnosis. So that was also part of that we changed, and we have the opportunity to have access to molecular tests for free. It wasn't enough, but at least we improved that. And definitely the vaccination plan changed a lot of things, because with Omicron, we just recently passed the Omicron wave, and I'm pretty sure if we didn't have the vaccination process before, pretty much we will repeat what happens at the beginning of the pandemic, but that wasn't the case. And just to finish this part, so right today I got my fourth dose, for example, because it's I have the luck to be one of the first groups to be vaccinated on March 2021, then the second dose in April, then the third dose it was in October, and now I could have the fourth dose. And that's because we have this plan, which is really good. I mean, compared to the United States, for example, the percentage of people that have been vaccinated, it's much higher in our country compared to the United States. And it's also very, comparing with other countries in Latin America, in our region, we are in a much better position. Just Chile and Uruguay, I think they're much better than us. So that's an example that we can do things, that we have the power to do things. And I hope that this is going to change how we do things in the future, because as Maria Fernanda said, if we don't have this, if we don't prioritize, if we don't have the strategy to see what is important, we will have a problem like this, pretty much as we have what happened at the beginning of the pandemic. As Miguel said, it was really terrible here in Guayaquil, which is the second city in Ecuador based on importance. And the situation was really bad. Guayaquil was one of in the top 10 cities with the highest mortality in the pandemic in the whole world. So it was just terrible. And so hopefully we will change that.
Great. Thank you so much, Dr. Rojas. I just want to say, as a proud moment for the university, Dr. Garzón, she completed her PhD in the College of Public Health at USS. She graduated from here, so yeah, go Bulls. So this has been a great conversation, and I wish, if we continue, we could be here until midnight, but I know you want to have dinner and whatnot. So I think it's a good time to wrap it up. I've been trying. It's been a great conversation. I've been trying. I don't know if I did it. I'm sure I didn't do it completely, but it's a good attempt. I hope it is a good attempt to summarize what has been said about what have been the challenges with COVID-19 and NCDs and infectious diseases in Ecuador, USA. So some positive aspects that were highlighted was in Ecuador was that now there's better research and diagnosis equipment, which has reduced the wait time for diagnosis and evaluation of patients with HIV, And it seemed to me that there was also mention of ICU development, like the capacity of ICUs had increased as a result of the pandemic. In the negative side, however, we have an increase in opportunistic infections among people living with HIV, probably an increase in new infections of HIV as a result of the pandemic, further discrimination of people with HIV and other diseases as a result of the pandemic, misdiagnosis, people with other diseases that have similar signs and symptoms, loss of employment for people living with HIV, and the firing of healthcare workers that were hired during the COVID-19 pandemic response, people dying from other diseases that went unnoticed because of the pandemic, and corruption. All these negative factors here seem to me that could be classified in two groups here. Those that are related to disease progression, both at the individual and the population level, and those that are related with the structural factors, like corruption, for instance, right? In the United States, what we had, it was a lack of universal health care and health insurance for everybody, physician burnout, conflicting regulations and overlapping regulations that add burden to the operation of the healthcare facilities, more focus on infectious diseases and a neglect of NCDs, health disparities, the fact that during the pandemic only COVID cases were being booked or being scheduled and no other issues, lack of focus on preventive care in the United States, and politicization of health issues like the mask mandates and people being seeing this as an impact or a curtail of the freedom, right? So those on the US side. As solutions that were mentioned from both ends, I could gather the following. Consider cultural and social determinants of health when creating health interventions. Telehealth as a potential solution to overcome the challenges of COVID. A greater focus on preventive care. The need for an interconnected, collaborative environment in global health, both in academics, but I also added in government. Because I think there is an interconnected, collaborative environment in global health to a certain extent, academically speaking. It can be better, but there is some level, even between the United States and Cuba, that you wouldn't think there is, right? But I think probably what we are needing is international governmental structures that provide a framework for preparedness and response, and health education and addressing misinformation as a result of the pandemic. Before we continue, I agree with what was said earlier. You mentioned Nigeria that it's a time of reflection. It's a time of reflection, and I think I would like to say that though we have never experienced COVID-19, we have experienced pandemics in the past. Everybody knows about the Spanish flu. Everybody talked about the Spanish flu at the beginning of COVID-19. We had something in the records to look at and draw lessons learned. We definitely have the lessons learned that we're acquiring today from the pandemic. And as we look forward, I wish that collectively we are prepared for the next time. We don't have a fight and flight response, but we actually have thought through this process, have learned lessons, and have developed a pandemic response plan that allows us to be quick on our toes to respond to the pandemic while preserving essential services, so people who have chronic diseases and other problems do not suffer as a collateral the impact of the pandemic, right? So we can maintain our essential functions while we are addressing a new pandemic. We can do that if we are able to elaborate a pandemic preparedness plan. Pandemic preparedness was talked about before the COVID-19 pandemic. You may have heard of the Global Health Security Agenda, probably. An instrument, an initiative of around 50 or 60 countries in the world trying to detect, protect, and prevent infectious disease threats. Actually, we talk about the Global Health Security Agenda in my Global Health Diplomacy class this summer. Free commercial. If you are looking for a class in summer, please join my class. But we talk about the Global Health Security Agenda, we talk about the international health system, and we talk about these issues, right? How do we respond as a global health system to this problem? So my closing words will be this. Let's work together to have a pandemic preparedness response plan that allow us to be quick in our close, but maintain essential services, right? Thank you very much for being here. Thank you very much to our colleagues in Ecuador for joining at this time. I don't know if Dr. Rojas want to say something, some closing.
Yeah, just to add that what you said at the end, it's pretty much what we have to do in every country, but we also need to work globally in every aspect. So we cannot say, for example, that in one country or one region the pandemic is over. It's not over if it's not over in every country. So we have to think globally from now on. And not just from the point of view that we have to work together, but globally as the One Health concept, right? So we have to think about what happens with our animals, what happened with the environment, what happened with all things that are connected to our health, because we now understand that if the planet is suffering, we will suffer sooner or later. And so that's the agenda that we have to have from now on. And if countries like United States, with all the muscle, the financial muscle and scientific muscle, don't pay attention to this to other countries, you are going to suffer sooner or later. So it's a win-win if everybody collaborates in these things. But if we don't want to do that, and especially it's the political willingness that we suffer a lot with Trump. Not only you, but us. We all the world suffered under Trump administration, unfortunately. But we also have at the same time another guy in UK, similar guy in Brazil, which still is in Brazil, denying this, saying things that are crazy things. That's the example that we don't want to repeat again in the future, because we have to collaborate and we have to think globally every time. And the only way to address this problem is in this. We are in one world, so we have to think globally in every aspect.
Thank you so much. One thing before we end, I want to task you. If you want to take this, I think it was a great conversation. If you want to take this and turn it into a manuscript, a lessons learned manuscript, in collaboration with the students in Ecuador, under the supervision of Dr. Rojas, I'm dragging you into this, but feel free to not be dragged into it. I'd be more than glad to work with Dr. Rojas in turning this into a manuscript of lessons learned of a conversation of the students in the United States and Ecuador. So if you want to do that, I encourage you to do that, and let's keep in touch. And one final thing, and I'm going to shut up now. Dr. Rojas, you remind me of there's a right in Disney World. It says it's a small world, right?
Oh,
it is a small world.
Yeah.
So let's work together. Thank you for being here. Have a good night.
Thank you. Thank you all.
Thank you.
And
Thank you.
Thanks
It
a
was
lot.
nice talking with you guys.
Thank you.
Thank you.
Bye.